Dementia by Sadie Vega. What is dementia? Family of diseases. It's a cognitive and behavioral deficit which involves some type of permanent damage to the brain. There are a dozen forms of dementia identified, and they're not caused by a fast onset of toxic substance or infection. The most common type of dementia is Alzheimer's disease. There are other types of dementia which can include Parkinson's disease, vascular dementia, Huntington disease, alcoholic dementia, and AIDS dementia complex. Dementia. There's no other condition related to aging that people fear more than dementia. Patients who have dementia can lose their minds, have reduced thinking, go from feeling like a normal human to a confused person, and also become a vegetative victim who cannot recognize their spouse or children. Dementia can impair their independent functioning, and there are several types of dementias that are irreversible and degenerative. Alzheimer's disease, the most common form of progressive, degenerative, and fatal form of dementia. Final diagnosis can only be performed through an autopsy, and the quick progression causes brain destruction where a person can eventually die. There are small changes that define Alzheimer's disease, which can cause rapid cell death, neuritic plaque, and neurofibrillary tangles. Rapid cell death occurs in hippocampus, cortex, and basal forebrain, which occurs at a rapid rate more than normal. The symptoms and diagnosis of Alzheimer's disease. Alzheimer's disease has gradual changes in the cognitive functioning. It can decline in memory, lose recent memory, progression of loss of remote memory, loss of learning, attention, and judgment, disorientation of time and space, a difficulty with word finding and communicating, a decline in personal hygiene as well as self-care, inappropriate social behavior, and a person experiences changes in personality. Finding the cause to Alzheimer's. It's not certain what causes Alzheimer's disease, and some forms of Alzheimer's disease are caused by autosomal dominant inheritance patterns, which is a gene given from either the mother or the father, which causes a trait or a condition to develop. Another genetic cause involves complex interaction with multiple genes, but these are not documented or understood. There is other research conducted in regards to the cause of Alzheimer's, which focuses on the changes that occur in the vascular system in the brain.